Hi, Dr. Barker here at Pete Plastic Surgery Center. So the question of should breast implants be placed above or below the muscle during a breast augmentation is a wonderful question. This is actually a very highly debated question throughout the plastic surgery community. It has a very, very large amount of discrepancy in people's preferences. So actually, when it comes down to the what is better for the patient, the implant above or below the muscle, the answer to that is actually patient preference. What are the increase or decrease risks with doing either one? And what are the actual statistics? So when we break this down, when we talk about placing a breast implant above the muscle, meaning it's sitting on top of your pectoralis major muscle, or when they say below, it's actually called a dual plane. Your pectoralis major muscle sits on the top part of the implant, and the bottom part is covered by your natural breast tissue. Both of these positions will lead to wonderful shape changes and improved contour and size of the breast. However, they will look different depending on the patient. So when I'm taking everything into account during my consultations with patients looking for breast augmentation, I need to look at the quality of skin of the breast, the quality of the breast tissue, the density of the breast tissue, and where is the majority of the breast tissue located. When we talk about putting it above the muscle, so we're talking again, that implant sitting above that pectoralis major muscle, I want to ensure that the patient knows you may see the implant curvature more than if it's under. And what I mean by that is we're going from the top of the breast down. You may see a takeoff where the breast implant starts when it's above the muscle more. The reason for that is when you go from skin, breast tissue, implant, there's not as much coverage as when there's skin, breast tissue, muscle, then implant. So the curvature may change a little bit on the upper pole, meaning you may see the takeoff to where the breast implant starts on the superior or upper aspect more. This is where it gets very, very, not confusing, but muddied. If the patient has a very good amount of quality, dense breast tissue above their nipple areolar complex, which means if I pinch their skin and subcutaneous tissues and I have over 2 centimeters between my fingers, you can actually expect to have that contour change from above be blunted a little bit more. If you have a patient that has very, very minimal or lack of upper breast pole breast tissue, this happens a lot of times with pregnancy afterwards, weight loss afterwards, where you have flattening of your upper pole and loss of volume, you will definitely see the shape of that implant coming off the superior aspect because it doesn't have that barrier of that pectoralis major muscle. When we talk about natural approach, typically it's always under the muscle, meaning if I have more of a coverage of that implant, we're going to get a softer transition point of the upper pole. That is because you have more coverage. Then when we go into what is best for the patient, if you look at the studies, there's a complication that happens with breast implant surgery occasionally, and it can be up to about 15%. It's called capsular contracture. That means your body is going to place a natural barrier over this implant. It's called the breast capsule. It is usually very thin, very wispy, very soft. You shouldn't be able to feel it or even sense it after the surgery is over. If the body produces more of that capsule, meaning overproduction, it can all of a sudden start tightening around that implant and becoming thick and hard. That can lead to what's called capsular contracture, and that is a major problem that many times needs to be fixed with surgical approach, meaning taking that entire capsule out and starting over. If you look at the book numbers, putting the implant under your muscle or in that dual plane, it is a less chance of capsular contracture happening versus over the muscle or under the breast tissue or under the fascia. Again, that is also very kind of a discrepancy between practices, because if you go into practice by practice, they have their own numbers because it's all surgical technique. Also, how do they handle the implants in the OR? A lot of the times we know that comes from contamination of the implant within the OR. That's why this becomes so muddy. So overall, if you look at the numbers, it is less chance to get capsular contracture under the muscle than over. Then when we talk about what does the patient hope to achieve, what is the style, what is the approach, the bigger the projection, meaning off the chest wall, is going to show the more upper pole fullness transition point versus lower projecting. That is because we are over projecting your breast. Again, depending on what implant you're using, you need to discuss this with your surgeon. What should I expect it to look like? I want it to be more natural. Then we go under. I want people to know I have an augmentation. I want that transition point. I want that upper pole roundedness. That is a great option for above the muscle. But again, this is where it comes back to, there are many, many different advantages and cons to above and below. You have to talk to your surgeon about all of these. Also, you want your surgeon to be trained in both. If a surgeon only does under, never does over, or vice versa, only over and never under, you're limiting your options. So in my practice here at Peak Plastic Surgery, I provide both, depending on the patient's wishes, the patient's anatomy, their breast anatomy and morphology, everything comes in. So again, what is better for a breast implant, to be placed above or below the muscle? Or should it be placed above or below? That comes into, you need to get these questions answered by your surgeon so you can make an educated, informed decision and be happy with the results that you will achieve. If you have any further questions about this subject or any other subject, please let me know. I'm always happy to answer these, and follow along for more content.